If this doesn't make sense, then man, it's been a long day. I've been on a placement. I've just got back from the gym, so so yeah, this is like been alhamdulillah a really eye-opening week for me. So yeah, I mean, assalamu alaikum everyone. I hope you are having an amazing day, and if you don't know who I am, my name is Muhammad and I'm a fourth year med student studying in London. And if you're new to the channel, I'm really glad that you are here today. Currently it's around 11:19 p.m. and I know it's really late, and I never shoot a YouTube video that late. But you know, I'm gonna try to like be more consistent and upload YouTube videos more regularly. So yeah. So in today's video, inshallah, I want to share with you a really valuable lesson that I have learned this week, and I hope it would be valuable to you as well. So yeah, I mean, let's get right into it. So this week was the start of my new clinical placement. So I finished last week was my last week of my musculoskeletal placement. So this placement was the start of my geriatric placement, and so far, man, I've been enjoying it so much. And like this week was like a game changer for me. And what I started applying in this week was something that I did not apply before. And you know, before like I started going to clinical placements regularly from like the middle of my third year, okay? And I've been doing the same thing from that time till the end of my musculoskeletal placement. So like not the start of this week, up till the end of last week, okay? So like I changed from the start of this week, okay? So what was the thing that I used to do before? So before I had this mindset, okay, that whenever I'm on clinical placement, we have this like structured timetable that was designed by I don't know, the doctors, anything like responsible for us, the medical students, in terms of like teaching sessions, like at a specific like say from 9 to 12 p.m. We have to like be on ward rounds, then we're gonna have teaching sessions. So like everything is going to be, so like we will have a design timetable for us, okay? So whenever like we're on the ward, we're like expecting the medical team to have like some sort of activity ready for us to engage with. So just like we go and show up to the ward, and we wait for the medical team to just show up for us, you know? So like for my first placement, everything went smoothly. It was amazing. So we had so much teaching sessions. I learned so much, okay? But what happened after the next placement? So what happened in the next placement? The total opposite. Like we had a structured timetable, but like the doctors there were too busy because they had so many patients that they have to help and deal with, so they did not have time to give us all of these teaching sessions. So like our timetable was not aligned with like what we are actually doing during the day. So like it was a time when I did not understand why this was happening, and sometimes it felt like it was so boring in the ward because there was nothing for us to do, and all of the doctors were busy for us, and as a result we don't have anything to do. And many times I just show up to placement. I'm guilty of this. I'm like gonna admit it at the moment. So I'd show up for like 1 or 2 hours, then just leave because I don't have anything to do. It's just like so boring. I'm not learning anything. So yeah, I mean, I'll be honest with you, it sucked, and like being on placement felt like it wasn't that rewarding, and it made me question Do I want to continue studying medicine or not? To that point, it was like that bad, I'll be honest with you. So yeah, I mean, this continued until last week. So I mean, I started thinking about this deeply. I started thinking about how to approach clinical placements. Like, there has to be much more to clinical placements than what I am doing at the moment. So I started thinking, what can I do? What things can I change so I could like get more out of my clinical placements? Man, like I'm in fourth year med school, and I need to like get more out of this. I need to learn more skills. I feel like there's so much for me to learn, and I have to, it's my responsibility to do whatever it takes to like get the most out of my clinical placements. And I only have 3 weeks into each specialty, and I need to like learn as much as I can about each specialty. So what I started doing from the start of this week, I mean, for me, Wallah al-Azim, it was a game changer. I said Wallah, like it was this amazing, alhamdulillah, like yani, this helped a lot. And this week especially was completely different compared to like my past experiences when I was in clinical placement. So what I did was, it's just like a simple mindset shift. So I just said, like before, I used to approach clinical placements waiting for the doctors and the medical team to come and serve us, okay, so that they could give us some teaching sessions, so that like they could teach us new things and tell us what to do, go and talk to this patient, do that, you know. And I knew, like, after being so many times on clinical placements, this thing isn't gonna happen, you know. Most doctors are busy. And what I started doing is I made a simple mindset shift. It's like I started thinking, how can I add more value to the medical team? How can I be how can I be more of service to the medical team? What can I do to help the medical team, you know? So I went to the doctors and told them, like, literally, doctor, do you need any help? Is there anything that I can do? Is there anything that you need me to do? How can I be of service? You know? And guess what? No, the amazing thing is there's always work to do. There's almost always things to do. Like, the doctors are really busy and they could use a lot of help from medical students. And the amazing thing is that, like, when I did this, I started learning new stuff. Like, the doctors were like amazing and told me, yeah, of course, like, come here, let's work on say the patient notes. And I've never like worked and documented patients' notes like properly. It was a skill that I did not learn before, like up until this week. And you know, at first it was so uncomfortable, like I was freaking out. I didn't know what to do, I didn't know what to write. But like, there's a learning curve for everything, you know. It's all about stepping out of your comfort zone. And every professional was once an amateur, you know. Every master was once a beginner. And okay, yeah, I felt so many times at first, like, so many things were unfamiliar. And whenever like a consultant asks me a question when I'm with one of the doctors and I don't know, like, say, and I'll be completely transparent at the moment. Like, yesterday, what happened was one of the consultants came and told me, this is a chest x-ray, come and present it. Like, say what you need to say about, like, say everything you need to say when it comes to presenting a chest x-ray. I said, like, even less than 25% of what should be said, you know. Like, I missed so many things and it was really embarrassing and it hurt. It was painful. But the thing is, it's good. It helps you identify and be clear about the things that you need to improve on. Like, say, if I didn't put myself out there, if I didn't take the initiative, if I didn't if I wasn't proactive and told the doctor, do you need anything, this consultant wouldn't have asked me this question regarding the chest x-ray. And as a result, like, I wouldn't have known that I needed to work on how to present a chest x-ray. Do you get what I mean? So, like, whenever you put yourself out there, wallah al-azim, like, you learn so many things. And failure is inevitable, you know? Like, many of us are scared, you know, even me, like, many of us are scared to put ourselves in an uncomfortable position because of a chance that we are gonna fail. But you know, the thing is, like, failure and success aren't the opposite, if that makes sense. Like, in order for you to be successful and master, like, any skill, you have to be willing to fail. You have to, like, accept that you will have to fail. Failure is an ingredient of success. So, I mean, so, like, this week, I learned so many things. I knew so many areas that I needed to improve. And yeah, like, because of the embarrassment that you get after, like, not knowing how to answer, this gives you, like, the motivation for you to learn and practice more. So that, number one, so that you avoid the embarrassment. And second of all, this helps you become a much better doctor. It helps you give you the motivation to become a more competent doctor, and as a result, you learn more stuff, and inshallah, like, you'll be able to be a valuable member of, like, a medical team in the future. And as a result, inshallah, help save more lives. So, if like, you're someone who takes initiative, if you're someone who is proactive, that's amazing. That's, like, continue, keep going, and you learn more stuff as you keep going. If you're like me, I'd highly encourage you to just, like, slowly step out of your comfort zone and just see how it's like. It's gonna get uncomfortable, but, like, it's gonna be uncomfortable, but, like, you're gonna learn so much stuff. If you don't, like, put yourself out there, you don't know the things that you need to learn. And if you're not clear about what you need to do, if you're not clear about what you need to, like, learn and master, then, like, you're not gonna master it, you know, because you don't have the clarity. You don't have the target, you know. It's, like, cloudy. It's like, you don't have a target, if this makes sense. If this doesn't make sense, then man, it's been a long day. I've been on a placement. I've just got back from the gym, so, like, so yeah, this is, like, been, alhamdulillah, a really eye-opening week for me. So yeah, I mean, I hope I was able to be of service to you in today's video. I hope, like, you learned a thing or two from it. If you enjoyed the video, if you found it informative, please leave a like and subscribe for more videos like this. And inshallah, I'll see you next time. Bye bye.